We're going to talk about Chapter 25, the high-risk newborn. We're going to start on page 664. A lot of our focus from this chapter has a lot of information in it, but our focus is going to be sepsis, infant of a diabetic mother, respiratory distress, and NEC. So that's kind of going to be where our big focus is in this particular chapter is in regards to your final exam. For your final exam, this chapter will have a total of 8 questions from it, so you can see as to why I narrowed it down to those 4 categories of what I want you to really focus in on. But a few things that are common, things that you may see on postpartum or labor and delivery when you guys go to it, I want you to look at box 25-1. These are the classifications of high-risk infants. This is what gives you even further definitions of a full-term infant, a late preterm, post-term, appropriate for gestational age, or AGA, small for gestational age. So this gives you some definitions that you would need to be familiar with in regards to answering questions. The other table I want you to look at is on the same page, 664, table 25-5, the types of birth injuries. There are a few that we're going to talk about. We've already talked about a cephalohematoma and a caput, and that was in chapter 22. A lot of times, if you have a large for gestational age baby, they can have a broken clavicle or fractured clavicle. They can also have Erb's palsy, where there is a break in the brachial plexus. There are some pictures of a fractured clavicle on page 665 and a picture of a baby who has the Erb Duchenne paralysis in a newborn. This is a picture of a newborn who has facial paralysis, and this is actually due to a forceps delivery. I know we talked about forceps some time ago, but this is just one of the complications that can occur due to using forceps. So we're going to talk about sepsis. Sepsis starts over on, I believe, 666. And when we talk about sepsis in a baby, the one thing you have to know about a newborn is when they become septic, they get sick very quickly. Some of the risk factors, things that you would need to be aware of, what would put a newborn at higher risk for sepsis versus another, are listed in table 25-3 on page 668. Risk factors include mom who had a prolonged labor, if she had rupture of membranes greater than 18 hours, premature labor, or if she had a UTI. So these are things that happen maybe intrapartum that would put the newborn at a higher risk of having sepsis. There are some other factors, maternal and neonate factors, that would also put them at higher risk. The other thing that I want you to look at is the clinical manifestations of sepsis. What's actually going on? What are you going to be actually observing, or what are you going to find on your assessment? Because now we're talking about a newborn who was born. So we are talking about monitoring them for potential signs and symptoms of sepsis. A lot of times early signs and symptoms include lethargy, poor feeding and weight gain, irritability. If they do have, or if you suspect as the nurse that the baby is septic, they're going to do blood cultures, urine culture, stool culture. They may even do a spinal tap where they would draw spinal fluid, and they would also do a CBC with diff in order to determine if it is true sepsis or not. A lot of times these babies will have antibiotic therapy. The one thing you need to be cautious with, and when we talk about NEC, is if you do long-term antibiotics and we haven't really gotten a culture back to say that it was positive, this puts the baby at a higher risk for developing NEC. Breastfeeding is encouraged for these babies. Why would we want to encourage breastfeeding? what's produced in the breast milk. We're giving IgM. We're transferring it over to babies, so we're helping them build their immunity. So this helps decrease their risk of being septic. Prevention, it's always standard precautions, always good hand washing. I'm going to sneak in a little bit, just a little information about drug-exposed infants. Something that you guys would need to be aware of, something that you may see the babies on in the nursery is something called an NSA score. A sample of an NSA score is on page 677. This is the neonate abstinence scoring system. This is a scoring system tool that is used to monitor withdrawal symptoms on a newborn so that we can act and intervene when necessary. Some signs and symptoms of withdrawal are listed on page 675 on box 25-2. Most common ones that you do see are diarrhea, irritability. They typically have a high-pitched, shrilly cry, vomiting, and they will be sucking frantically. It's a soothing mechanism, so they're trying to soothe themselves. So they may be trying to latch onto their hand and try to do some non-nutritional nutrient sucking.